This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Awesome. So my name is Christian Villegas. I am one of the co-chiefs, along with my co-chief Matt Wilson, who will also be online. So I'm just going to go ahead and share my screen here and get started with our program at Loma Linda. If you have any questions throughout my presentation here, go ahead and throw it in the chat, and Matt will do his best to get an answer for you. All right. So I'm here representing Loma Linda, our PM&R department. So let's see here. Here we go. So where is Loma Linda? Kind of the first question. So Loma Linda, Southern California, pretty much you can kind of consider like an hour away from a lot of different things here in the Inland Empire. So, hour away from the mountains, an hour away, we can do skiing, camping, a lot of outdoor recreation. As some of you guys know from being from Southern California, we have sports, surfing, bouldering, climbing, national parks. I've been able to go to quite a few of them throughout my time here, which has been super nice. Loma Linda is known as one of the blue zones. For those that don't know what a blue zone is, it's one of the areas where you find centenarians, those that live up to 100 years of age. So we even have had some of those even at our acute rehab while here. It's a very strong, very invigorating town. And even though it's resting within San Bernardino County, it's kind of has its own kind of, I guess, microculture, micro community. A lot of people here living very healthy, whole food, plant-based diets, resting one day a week on the Sabbath, and just a very kind and considerate community. It's been really nice to be a part of. In terms of what is our mission, so we are a hospital. We are associated with the Hospital of the Seventh-day Adventist Church. So it's to further the teaching and healing ministry of Jesus Christ to make man whole. And we focus on a few different, that encompasses a few different domains, including clinical care, helping to make competent not only physicians, but also competent educators, and also focusing on a good amount of research and wholeness, which I'll touch on in just a little bit. And here's kind of a picture of our really nice Tom V and Zapara pavilion, where some of our rehab patients will go to. Sometimes they call it hotel rehab because of the nice wood, semi-wood paneling and the carpeting as well. So one of our aims is to educate and equip physicians in PM&R to foster compassionate and growth-minded physicians. And so we really look for that in our candidates, and then also try to foster that with our attendings and our residents that are here to make lifelong learners and to promote excellent whole person care. We do have a pretty nice whole person care curriculum that focuses on how to be able to not only treat the patients in terms of their physical needs, but also addressing their mental, emotional, spiritual needs, connecting them on an interpersonal level. And sometimes those can be, barriers to helping them really buy into our rehab program. Sometimes it's being able to connect with people like loved ones who are far away. And it's been a really great experience. We have 3 to 4 lectures each year, and it's been a really great thing to be a part of. So in terms of positions available, we have 4 categorical residents per year, and then we have 1 advanced resident slot per year. In terms of our training sites, what's one of the strengths of our program is that it's all pretty close together. So you don't really have to drive farther than maybe about a 1 to 2 mile radius, with the exception of our Kaiser site, which is over in Fontana. But that's really nice. It's all pretty central. So you can either live close, you can live by Loma Linda or some of the surrounding communities like Colton or Redlands, or live a little bit farther away, but know that where you're driving to is pretty close to the other sites. In terms of the overview of our rotations, so in terms of your intern year, if you were to be a categorical resident here, a lot of your year spent in internal medicine's rotations or subspecialties, and then you have a month of PM&R and also a 1 month elective on top of that. And so we spend some time, like I mentioned, at the VA, at the Loma Linda Med Center, looking at their wards or ICU, some CC rotations, as well as infectious disease, neurology. We try to choose subspecialties that you'll often either encounter quite a bit in our rehab unit, or patients from those specialties coming to our department too. People that are deconditioned from chronic and infectious or chronic infections, or having end-stage renal disease. It's just something to be familiar with while we're here. In terms of our second year, that's where we start. There's a good amount of, I would say, inpatient rotations in our second year. You might have seen that as a common thread as compared to some other programs. So we have at least 2 to 3 months of stroke, brain injury. In terms of brain injury, we do have a brain injury fellowship trained physician who's attending on the service. And then also spending a few months' time at our VA as the junior resident on that team. And that's where you would probably see a lot of our general rehabs. We have a good amputation program and relationship with our vascular surgery and orthopedics department, and also seeing quite a bit of orthopedic post-op cases like knee replacements, hip replacements. And through that, you also have about 6 months of outpatient, 6 months of inpatient roughly, with our outpatient focusing a lot on our musculoskeletal complaints. We have great access to ultrasound machines. There are several different ultrasound machines. And in fact, our ultrasound curriculum is led out by one of our VA outpatient attendings there at that site. And so you get a lot of great in-person exposure. And in fact, we have an ultrasound elective that's guided at that outpatient VA site. And so you get to rotate there again and be able to just have pretty much the whole day filled with ultrasound guided procedures as you go through the curriculum, which is really nice. We do have patients that we do refer out to our EMG, although you don't do EMG during your second year, that'll be during your third year. And then you also have opportunities for lots of different electives that you want that you can be able to participate in, including neuromuscular movement disorders. We have a headache specialist at our East Campus or at our faculty medical clinics. And then spinal cord injury, strokes, you have opportunity to be able to rotate through there as well. And then we also have we have 2 dedicated peds physiatrists with us on our staff. In terms of our third year, you have the continuation of your inpatient rehab curriculum, including your spinal cord injury. And then going from there, it becomes more and more outpatient based as you go through the years, including you have your VA clinic again that you can rotate through. And then you have 5 months of EMG, which I think is really nice. I think we have a really good experience on our EMG rotations, especially because it's 5 months with maybe 1 month being interrupted in the midst of that, doing a different rotation. But we get a lot more exposure, a lot more cases compared to our neurology colleagues who rotate through, who often are interrupted and pulled off for different things, whether it's backup call or continuity clinic or things like that. We're there consistently. So you learn pretty quickly. And I think you learn to master it in a lot of different cases. And then some of our residents that didn't get an elective during your second year will get it during your third year. And then with our fourth year, that's where we spend some more time again at our VA Ambulatory Care Center, and then rotating through Kaiser, like I mentioned before, and having the opportunity to you can do a selective. And if you want to go back and rotate through those inpatient rehab rotations, you definitely can, and go through spinal cord, stroke, or TBI again. Pain medicine can be, we do have pain medicine as one of our fellowships that's here at Loma Linda. So we have a lot of access to our pain medicine department, and you can do so through your electives during your fourth year, your second or third year, as well as pediatrics. And we've heard of some that have, what's nice about our program is that it's actually very flexible, and meaning that we can be able to have the flexibility to build our own elective if we wanted to, which I'll touch on in just a little bit. But moving on to our didactic series, I would say it's a pretty robust didactic series. That's a 12-month cycle. So going from July to June, we have a rehabilitation series looking at stroke, TBI, neuromuscular, prosthetics, orthotics, peds, pain, and rheumatology. Some of those are led by residents, some of those are led by our attending physicians. We also have dedicated grand rounds, which over the last couple of years now, we've not only just isolated it to just the physiatrists, but also doing multidisciplinary grand rounds. So some of those are led by our neuropsychologists, our occupational therapists, physical therapists, speech, and our physiatrists as well. And then we also have evidence-based medicine, a curriculum that's integrated, led by our PGY4s, and Journal Club, which is led by our PGY2s, but guided by one of our directors of research. and also have a morbidity and mortality series. We have QI projects led by each class. So each class has a faculty advisor that will be able to guide them through their quality improvement projects. And like I mentioned before, we have our whole person care series. And in terms of musculoskeletal series, that is guided, integrated both between our resident physicians as well as our attending physicians that will guide a portion of the anatomy, physical exam workshop. What's nice is that at the ambulatory care center, we're starting back up again. COVID interrupted it, but we're starting back up, the ability to break out into different different clinic rooms and then have an attending physician that'll be able to guide you through each of the physical exams, looking at shoulder, looking at knee, ankle, hip. All of those, our radiologists help lead out our radiology part of the series. And we have a therapist that integrated to our therapeutics. We also have a resident wellness chief currently, that's Andrea Joku, which has been doing a great job. And we have these resident families that have PGY 1, 2, 3, and 4, all in each family. And we have a kind of a friendly competition going on to see if you're able to participate in certain activities outside of work together, you get more points. We'll put pictures on our group chat to kind of put evidence that we actually did participate in Hangout. And right now the theme is Pokemon. So we have different Pokemon assigned to each of the family groups. And so as you gain more points, your Pokemon will evolve to the next iteration. And each of this month, I think we've been focusing on the world's most popular sport, pickleball, and then we'll kind of move on to different things so we can, if we're able to participate in that activity, we get bonus points. We also have neuromuscular and EMG seminars as well. In terms of research scholarly activity, so you probably have seen already that we have, we've participated in different ways. We have our QI projects, and then each, starting as particularly as 2, you'll be more emphasized, but also as a 1, you'll meet regularly with our research director, Dr. Tran, and be able to select a research project, which you can be able to choose one, or you can partner up with a resident, maybe a rising PGY 2, 3, or 4, or inherit another project. And that'll be your project that you'll be working on throughout your residency. And you'll meet regularly with your class as a source of accountability and also advisement. And then we have our PowerPoint templates that we use to present how our progress has been doing in our project, which prepares us ultimately for our annual research days at PGY 4, where we present that project. And essentially, if we do a good job preparing that, it's really easy to prepare for the future. And we have a lot of opportunities to be able to present at different conferences, some locally and some like AAP, PM&R that we can present nationally too. And what's nice is that our research director is also, he's MD, PhD. And so he spent a lot of years doing research, and he's been a great asset and a great resource for our department. And let's move this up a little bit. Okay. And then in terms of what makes us unique, so I mentioned that we have a formal whole person care curriculum. So not only is it modeled, I think, by a lot of our attending physicians here, but we also have a formal curriculum that's integrated between our family medicine, one of our family medicine attendings, and also our pediatric physiatrists that work together. And we kind of have different practice cases to look at how we would assess and be able to provide whole person care to patients. Looking at even how to integrate that into our chart so that not only for ourselves, but other providers can be able to touch on those different points on maybe it's emotional or behavioral well-being that we're trying to focus on. And then our faculty members are super supportive. I remember there's a time where during my second year, actually around this time of year, my AC had broken. And so my wife and I were suffering in the heat in our house and told my attending about it. And fortunately, I was able to get a loaner unit from somebody else, from a neighbor, a portable unit while our AC was getting fixed. But he was even willing to try to pitch in and try to to purchase a unit for me in the meantime. So super nice, super supportive staff. We also, like I mentioned, we have electives that we can use within our, that are already established, like our ultrasound curriculum, or using our radiology elective, or we have the opportunity to be able to build our own elective. So down here, I highlighted that we have the Global Health Institute. So if you're interested in international work or even mission work, global health, we have the opportunity to do that because we have a pretty established relationships at several international sites across the globe, including in the Americas, and then even outside of that too, in Asia, Africa. So I was actually able to build my own elective and go to a hospital in the southern part of Africa, spend a month there, and be able to get credit for it, which was super nice, and be able to learn just what it's like to do international medicine at a third world level. We even had the person that established our program even has relationships out, and I believe it is Switzerland, if I'm not mistaken. And so they have a cardiac rehab out there. And so that's been a really big blessing in our program. It's just the flexibility of our attendings and just willing to support us in any way they can. In fact, a lot of my classmates, myself included, are at least 2 or 3 are looking towards a fellowship and looking for further postgraduate training in our class. It's 4 out of the 5 are looking for that. And so one a common place that people will often look to is pain medicine, but TBI and pediatrics has also been a focus in our class. And so it's been really nice to be able to have pediatric and brain injury board certified physiatrists in our program be able to guide us through that process. We've even had sports medicine. And so just the flexibility of our staff to be able to help maybe establish a relationship with a community physician to be able to get more exposure or to work at the sidelines and things like that to get more exposure for sports medicine. Being able to do that in our program, it's not more of a question of if, but just working with our physicians and how. And in terms of location, I think it's a big strength too. Like I mentioned, we're an hour away from a lot of different outdoor recreation activities or city activities too. We even are 5 hours away from some of my favorite places, including Mammoth and Sequoia. So I'm a big fan of camping and backpacking myself. And I mentioned already that we already have an in-house pain fellowship program. So that's really nice to be able to have opportunities to observe and even participate in ultrasound or fluoroscopic guided procedures. And we also have our Possibilities program, which is a great program of support for those with disabilities, and be able to see that you can be able to find meaning and purpose and be able to do activities, maybe the same activities, but just in a different way. In fact, I have a picture here of our Paralympic qualifying event that we had at Loma Linda with some cyclists and be able to see we participated as athlete chaperones for the American Drug Testing Society and be able to see some of them pretty much get announced to be able to go to the Paris Paralympics. That was a really nice, really special moment for us. And I'll leave here, kind of finished a little bit early, but leave up here opportunity to be able to ask questions. And I just want to let you guys know that if you want to learn more about our program, we have our Loma Linda Instagram page through PM&R, and then we have some YouTube videos for those that are interested more in global health. I made a YouTube series about what it was like being a physiatrist in a third world country and be able to work with different departments and kind of build my own elective. So yeah, thanks so much for having us.
All right, thank you so much for that wonderful presentation. I don't see any questions right now in the chat, but they do pop up.
Not a problem. Josh, yeah, I would say that our program is definitely, we're definitely open to taking IMGs. In fact, Loma Linda is one of the places that I think probably gets quite a bit of IMGs because of those international connections. And also looking to make our program as diverse as possible, just to have different perspectives. So I think that currently, I don't think we don't have any IMGs currently in our program, but I know, that knowing my program director, that we definitely are open and happy to take IMGs in our program. Good question. So there isn't a requirement on being a Christian by faith. I think that the biggest thing we look for is, looking to train, compassionate physicians that are interested in whole person care and be able to address patients at multiple different levels, psychological, sociological levels. So if you're interested in buying into that mission, then I think that we look for candidates that follow that. And then we don't necessarily have a step 2 CK cutoff. I think that we're looking for, have that to help train competent physicians in our program. Yeah, thank you for reminding me. I'll put him under my contact info, and then Matt can put it in his too. And you can feel free to reach out to us if you have any questions. Yeah, in terms of our whole person care curriculum, so it's integrated into our 12-month curriculum. So we have, I believe this year we have scheduled at least 3, if not, I think three lectures this year. And so that's into, so Wednesdays and Fridays, I did mention that earlier. Wednesdays and Fridays are our days of didactics. We have 2 hours on Wednesdays and then 1 hour on Friday. Usually those are designed to happen on our Wednesday on didactics because we have a little bit more time. And so often we'll have our family medicine physician partnering with our pediatric physiatrist to kind of build either lecturing on some principles of 4-person care and then giving some opportunities to practice that. So we'll either give some practice cases and kind of go through how we would approach certain situations, or we might also be able to discuss them, with our physicians that are also guiding the lectures too. And then in terms of how it's integrated into our rotations, I would say it's in terms of rotations, it's probably more often modeled. Probably our pediatric physiatrist, when you rotate with him, he probably makes it a little more formal in terms of their curriculum. But I think how we would probably address it in terms of rotations is during our interdisciplinary team meetings to see if there are certain things that are either impacting their ability to participate or progress in therapies. We'll analyze that with our neuropsychologists, with our social worker, work together and kind of be able to discuss and talk that out.
Okay, so I'm
Go
sorry,
ahead.
this will be your last question. We're over, but that's okay. I'll allow it.
Gotcha. So the last question in regards to, oh yeah, I think Dr. Matt Wilson's already addressing that, so I think we should be good.
Yeah, sorry. So thanatology specifically, I don't think we've had a lecture yet. It does fall under the purview of kind of what we cover, but more often it's addressing what's important to the person and treating them in that context. Ethics does come up occasionally, and there is an ethics committee that I believe residents can become a part of if they so choose.